السلام عليكم.
عليكم السلام.
صوتي واضح؟
نعم. مساء الخير.
أهلا بالدكتورة.
أهلا نقيب، صوتك واضح.
أهلا
إيه
وسهلا.
ممتاز. اطمئن دكتورة
كيفكم؟
مازال دكتورة.
آمنة.
السلام عليكم،
تفضلي.
كيفكم؟ إن شاء الله بخير، طمنونا عنكم.
سلام.
يا هلا
أستاذ
وسهلا.
رضوان
كيف
اشتقنا لك.
الحال؟ الأكثر والله.
الله يحفظكم.
Okay. Good evening, everyone. Distinguished speakers and participants. Welcome to this strategic webinar on mental health security, sustainable investment, innovation, and governance in the Middle East. This strategic webinar is organized by Global Innovation Institute in partnership with Global Innovation Summit. I'm Dr. Allama Al-Mehdi, co-leader of the community of innovation of climate and sustainability. And I will be moderating today's session alongside with my sister and co-leader, Dr. Amna Al-Farhat.
Thank you, Dr. Allama. We are honored to convene this high-level dialogue, bringing together experts across health systems, investment, innovation, and policy. Today's discussion positions mental health not only as a public health issue, but as a strategic pillar for resilience, security, and sustainable development.
Our objective today is to identify actionable pathways and foster cross-sector collaboration between all countries. The former includes a keynote speak perspective, followed by target expert interventions and two collective discussion moments.
Yes. We invite all speakers to keep their contributions concise, strategic, and solution-oriented.
The keynote speech will be delivered by Dr. Najwa Azhar. We are honored to have you as our keynote speaker. The floor is yours.
Thank you so much. Good evening, everyone. Greetings from Morocco. And thank you to all the moderators, the speakers, and colleagues. What makes this conversation especially important today is that the Middle East is living through overlapping transition at once. So we are suffering from climate stress, geopolitical uncertainty, which remains persistent, economic restructuring is uneven, and social pressures are deepening, especially for youth, women, displaced populations, and communities which are exposed to repeated instability. So in that context, mental health is not simply an outcome of the crisis, it's also a big determinant of resilience. So the real question before us today is not whether mental health matters, because it does, but the real question is whether our policy, investment, and governance systems are ready enough to treat it as a strategic infrastructure. So the first main objective here is to answer the main question, which is what is the key lever to elevate mental health from a public health issue to a strategic priority in security, investment, and resilience. So in my view, the key lever here is strategic repositioning through governance, because mental health rises to the level of strategic priority when it's no longer discussed only in mental health, in ministries of health, but also in ministries of finance, labor, education, environment, social affairs, and national planning. So it becomes strategic when decision makers understand that untreated psychological distress weakens not only individuals, but also institutions, workforces, community cohesion, and national resilience. In other words, the turning point is governance, because if mental health remains a standalone health topic, it will continue to be underfunded, stigmatized, but reactive. But if it is embedded in resilience planning, in ESG thinking, in that way, it would be embedded in education system, in humanitarian response and climate adaptation, and then it becomes visible as an enabling condition for development itself. The second main point here is how can mental health be credibly integrated into sustainable development agendas in the Middle East. In my point of view, mental health should not be inserted artificially into sustainable development agendas. It should be integrated because it's already embedded in them. Because if we take sustainable development seriously, we are talking about human well-being, social inclusion, equity, institutional effectiveness, decent work, education, urban resilience, crisis response, and long-term stability. So mental health sits across all of these. It's not a side theme, it's a cross-cutting condition for whether development strategies actually work. So credible integration in the Middle East requires three main shifts. The first one is to connect mental health to prevention and not only to treatment, because a sustainable development lens asks different questions. What in our environments, institutions, and economic models is generating distress? Job insecurity, displacement, ecological anxiety, social isolation, conflict exposure, digital overload, all of these are not isolated variables. They are structural pressures, and a credible agenda must therefore include prevention through better policy design and not just more services after harm has occurred. The second shift is to adapt the language to regional realities, because in our region, the most effective entry point may differ from one country to another. In some regions, the language of social cohesion may resonate more than the language of mental illness. And in others, workforce productivity, youth resilience, family stability, or community recovery may be stronger entry points. So strategic integration requires cultural intelligence. And the objective here is not to import a template, but to build credible regional models. And the third shift is to recognize mental health as a part of responsible investment. This is very essential because sustainable investment in mental health should not be reduced to niche philanthropy. It should be understood as part of investing in stable human being, in social resilience and better work environments and innovation ecosystems that respond to real vulnerabilities. The third main point is to answer the question of how can climate-related vulnerabilities be transformed into resilience opportunities in mental health. This is where I believe discussion must become more forward-looking, because climate change is usually discussed in terms of water stress, of heat, of food systems, energy, pressure, but climate disruption also creates psychological strain, like anxiety, grief, uncertainty, and the cumulative pressure of living in prolonged instability. So the opportunity here is to stop treating this as an invisible side effect and instead to build climate resilience models that explicitly include mental resilience. That means three things. First one, mental health must be integrated into climate adaptation planning. Because when we are designing local resilience strategies, humanitarian responses for systems adaptation, or even urban heat responses, psychological resilience should be part of the architecture from the beginning and not append later. The second is that climate vulnerability can drive innovation. This is very important for our region because climate-linked mental health risks should become a field of practical innovation. Low-cost digital support systems, school-based resilience models, and mobile services for fragile settings and workplace interventions in sectors exposed to environmental stress. The third is that resilience must be local. The strongest responses will not come from generic imported solutions. As said before, they will come from models rooted in local institutions, municipalities, schools, employees, civil society actors, and community networks, because regional relevance matters, and this is exactly the lens climate-related mental health requires. So to close my intervention, if I may leave one central message here today, is that mental health should be treated not as a downstream consequence of instability, but more as a strategic condition for resilience, development, and governance. In the Middle East, especially, we don't need to choose between security, sustainability, and mental health. We will be facing more and more complications because these agendas are already interconnected. The task is now to design our policies, investment models, and governance systems accordingly. Because if we continue to isolate mental health, we will continue to underperform on resilience. But if we place it where it belongs, at the center of sustainable development, institutional preparedness, and responsible investment, then mental health can move from the margins of public disclosure to the core of strategic action. Thank you so much. You are muted, Dr. Alama.
And now can you hear me?
Yes, yes.
Oh, okay, perfect. Thank you, Dr. Nejwa. Thank you for your very strong keynote speech. It's a very a good and strong strategy foundation. Now, we'll move to innovation ecosystem with Dr. Radwan. But before, as we move to introduce each speaker, we will ask you to introduce yourself. Dr. Nejwa, can you please introduce yourself shortly before to go ahead?
Of course, I'm Dr. Najwa Azhar. I'm an international sustainable development expert. I actually work as the sustainable development expert at the Union of Arab Chamber, the representative of Arab private sector, and I'm the ESG research associate at the American University of Beirut School of Business. Thank you.
Thank you. We are very proud to have you and to have all of you here.
Much.
Dr. Radwan, the floor is yours. If you can introduce yourself before, please.
Assalamu alaikum. Good evening, everybody. Thanks for this distinguished meeting with the special and precious guests and speakers. I'm Radwan Shraib. I'm now the president of the National Association for Science and Research in Lebanon, which is an innovation association. The founder of Mubarat al-Ulum, which is the oldest and the largest science fair and innovation event for youth in Lebanon and in Arab countries since 2003. I'm also a member in the executive committee of the International Federation of Inventors Association, IFIA, which is the largest organization recognized by the United Nations as the highest level of organizations that works with innovation and inventor and inventions and worldwide. Our headquarters in Geneva, and we have 4 regional offices. One of them is in Beirut. It's known as the Middle East Focal Point of IFIA FME. And I'm the director of this focal point to try to meet the expectations of the innovators in the Middle East. Also, I'm a co-founder of the Beirut International Innovation Show, BIIS, and as different roles in Lebanon in education and technology and uh, governmental role in these two sectors, innovation and tech and education. Also, a founder of a program for students, for K-12 students, and a special curriculum for innovation and STEAM, science, technology, engineering, arts, and mathematics. And I have a good experience in as a certified innovation expert and jury in the United States and MIT University and ISEF exhibition in Germany, in Vienna, in China, CAI, in Canada, ICANN, and Malaysia, and other. And also, we were in the first involved and in charge the first initiatives to involve the youth innovators in international innovation events since 2010. 16 years ago, Lebanon was the first country that has the challenge to participate in expert exhibitions of innovation with under 18 students from Lebanon and later from other Arab and North Africa countries. It's sorry to just to introduce some roles of the institutions that I represent in this event.
Thank you, Dr. Radwan. I think you have some slide to share, right?
Not necessarily. Maybe at
Okay.
during that speech we can share
Okay,
if necessary. If necessary,
oh,
about I don't think there's time maybe to share.
okay, perfect. Then let's go to your first question. Tell us, Dr. Radwan, how
Yes.
can scientific ecosystem drive scalable mental health solutions?
The science is on the edge of this issue, the mental health security. So as we focused in EFIF focal point and also in the National Association for Science and Research, and in our event, the science match is very important in this issue. Many projects of youth students and also of university students, of corporate, of startup people have successfully transitioned into real world applications through this the mental health sector, if you want. Using many technology, especially AI now, you have, in Lebanon, we are in Middle East nowadays. We are in crises, we have wars, and we have the technology critical issue, where people are in contact with and involved in this technology. So it's very important to approach this issue through science and through innovation. Many projects about time management with technology, for example. Uh, you know, the use of technology now is in direct relationship with mental health. The post results of wars and crisis, economical crisis, political crisis, and a war crisis, and all these issues. Um, IFIA and National Association for Science and Research dedicated to identifying innovators who are leveraging AI, biotechnology, and digital health to solve the very stressors that weigh on our societies. We don't just celebrate the patent, we champion the person, ensuring that Middle Eastern intellectual property is protected, promoted, and positioned for sustainable growth. Also, uh, and the to bridge the innovation and mental health security, the convergence of innovation and mental health is perhaps the most significant blue ocean, if we can say that, for entrepreneurs today. Through IFIA's network, we are seeing a shift where technology is no longer just a tool for productivity, but a shield for human resilience. As mentioned by Dr. Najwa, Dr. Azhar. Uh, so we're whether is wearable tech that monitors physiological stress. There's many projects for presented by innovators, wearable tech that monitors physiological stress, or AI platform, or related tech with AI that provides decentralized physiological support. The opportunities for innovators are vast. Our role at IFIA FPME is to ensure these resilience technologies, to find investment and regulatory pathways they need to move from the lab to the citizens who need them most. Um, so if we want to put a vision for Middle Eastern people and for West Asia and North Africa people that we represented in IFIA and as a hub for innovators, um, we don't need just to consume technology, but to export solutions by aligning the historical excellence of, for example, association in the region, like National Association for Science and Research in Lebanon, with the global infrastructure incubated by IFIA. We are trying to create an ecosystem where innovation serves the core of human development. We invite our partners in government and investment to look at our innovators, not just as startup founders. It's not easy to found the startup, but the challenge is to continue and to sustain this startup. But it's not just a startup founders, but as architects of regional stability. I think together and through the cooperation, which is essential and critical between different governments in the region, we can do a lot. We can have a dream, if you want, to transform the region for a global hub for innovation and sustainable progress. Thank you.
Thank you, Dr. Radwan. Thank you so much. Very interesting. We now turn to digital transformation with Dr. Rabi. Dr. Radwan just mentioned that digital is one of the most important things for innovation in mental health solution in our region. Then, Dr. Rabi, floor is yours to present and introduce yourself. Thank you.
Thank you, Dr. Mahdi. Thank you, Dr. Amina. Thank you, the panelists, all of the present today in this promising start with you, Dr. Amina, and with the colleagues that they are establishing something really interesting to be as a platform and started directly to action plans after this session. I will be summarizing many important points. If you ask me first to introduce myself, my name is Rabia. Everybody from outside Lebanon, they call it Rabah, but okay, good winner. And it's a good adjective for my name, but my name is Rabia. I'm the president of the EdTech Syndicate, Education and Technology Syndicate in Lebanon. During Expo Dubai, we established the union of the MENA EdTech Alliance for 22 countries along the region. And then recently, just in January in London, we've been co-founder of the Global EdTech Alliance of Alliances. When we talk about education and technology combined together, here we are talking about something very special toward the digital transformation, especially when it comes to education sector. And of course, our main slogan is to innovate in education and to educate on innovation. So this both things can categorize the fourth industrial revolution elements, and where basically the digital economy there, when we talk about artificial intelligence, IoT, talking about cloud computing, immersive technologies, cybersecurity, even robotics and integrated systems, 3D printing, and of course, big data. Here, when it comes to these main elements, we are talking here about alignment of two things. Alignment based on the SDGs, and I don't want to take the role of Dr. Najwa here, but we are focusing on two important SDGs. The fourth SDG, which is quality in education, and the ninth SDGs, which is the infrastructure. Yeah, of course, we are talking here about the digital infrastructure and the innovation itself. So when we combine these two objectives together, two goals together, from the education prospect, we can, of course, produce many innovations regarding the mental health, all the health tech or other main sectors that we can believe it will be an open gate for through the digital transformation. So now digital transformation it become innovation transformation in more accurate words. And if we just addressing this, we can combine what Dr. Najwa mentioned with what Dr. Radwan mentioned and with what I'm gonna talk about, and even with what my colleagues will be, of course, have their contribution about this important subject. From our point of view, of course, in December, we started in 2024 establishing the AI Arab Union or Arab Union for Artificial Intelligence and Programming. It's basically started from Lebanon and now in Qatar. Why in Qatar? Because we believe Qatar just planned to invest $250 billion regarding the AI, and especially for the servers that produce AI, not only usage of AI. And from the other hand, which is something very important, is the entrepreneurship and how we can adhere and we can support the youth in order to become more involved in the production and not only in the usage of the digital sectors or digital transformation solutions or whatever. So from this point, we have to address here the Global Innovation Index, which is very important point to have some figures about what's going on in the region, especially in the Arab region, where only Saudi Arabia and Qatar and Emirates are in the first 50 ranked countries in the world. But the things that come here to the mind is how to rank more, how to increase the ranking of our countries, because in somewhere it's not a complex issue, especially after what mentioned by Mr. Ridwan. And in the same time, we have to work on this because most of the ranking categories, it's basically about researchers, how much researches it does been delivered to WIPO or can be reported to WIPO, the World Intellectual Property Organization, which also, of course, let's say a catalyst for the IFIA at the same time. So in this matter, here we have to focus on not only how to research things and just have ranking the universities in the better ranking, but also to take the research into development. And here it's very important because we have a lack on development in the region, but we have millions of researchers that is inside lockers and not being taken away or taken out to be developed in the right way using the digital transformation. Because the digital transformation is a one way to take the inventions to the patents, the innovations to the real impact on the society and real impact on the sectors of businesses and sector of real life. In the second hand, I have to address also very important point, which has come in some emerging countries. It can be difficult, but in other countries it can be easy when we talk about the investment in innovation in mental health or in digital transformation. Because digital transformation, also in the second hand, it's not only about acting with solutions. It's also about legalization. If you don't have laws and you don't legalize the digital signature, the data center, the privacy, you work as like RGTP and other laws and acts that can support and make like a framework for launching digital transformation, you will lose a lot of goals and you will lost all your investment if you don't protect it very well with legalization and with legal terms. In the second hand, where's our specialty in educational technology? Of course, in addition to what Mr. Radwan mentioned, in order to have a good impact on the Global Innovation Index, we have to have a registered patent. We have to show also a startup registration, regardless of the sector we are focusing on. Basically, from my side, I usually take the things in a different way to have something like related to a mindset more than to solution. So if you work on the mindset development, and from this point we transform what's calling long life learning into long life innovating, because we need to innovate. We are in the fourth industrial revolution. This revolution is basically focused on the mental. It's not focused in the oil. It's not focused on the mining, or it's not focused on the data only. It's focusing on the intellectual property. And from this prospect, we can do a lot of things. I will mention one of the or two basic important methodologies. The first one is the biomimicry. Artificial intelligence itself is a biomimicry about what Allah had been put in life. It's not only about imitated the nature, it's about imitated also what Allah had been put in the nature and in the human being.
Just a second.
But
Just
I still have time. You can hear me?
if you don't mind. Thank you so much. We are asking you to introduce yourself, and you reply to your question before asking. But
No worries, because you just mentioned the digital transformation.
it's
Okay,
not
don't worry.
usual, not common, but
No worries.
okay. We can go ahead and we will take it like a second keynote speech. Then go ahead, just to make
Please.
sure and to not confuse our audience. You already finished to
Yeah.
introduce yourself, and you are delivering your keynote speech. That will be the second one. We are improving. Thank you. You can go ahead. Sorry for
Thank
interruption.
you. Thank you. Okay, no worries. So how much time I have?
You still have 4 minutes.
Okay. So let me summarize it from here. So we talked about the legalization framework. We talked about digital transformation, basically aligned with SDGs and for industrial revolution. And the most important thing, it's about the innovation mindset. To create innovation mindset, you need all of what I mentioned. So you need the environment, you need the governmental protection and support, and not only that, the strategy. They should write a strategy for the innovation that can support the sectors in digital transformation and different sectors of digital transformation. For this, when we talk about innovation mindset, here we are really talking about a journey of that started from what Dr. Najwa and Mr. Ridwan mentioned, from the schools and go to the real life. So I was mentioned about the biomimicry because I just mentioned that artificial intelligence itself is a biomimicry of the human brain. So when it comes to the health and it comes to the mental health, first of all, we have to talk about the behaviors and we have to talk about how to educate people to think right and to produce good solutions that can help the people and the citizens and can help the countries to be really revolution set up in the right way, especially when it comes to the innovation in the fourth industrial revolution. We have many opportunities there. It can be counted because as much you merge any of the elements of the fourth industrial revolution, and as much you aligned it with the SDGs, and as much you aligned it with the new ideas and solutions, and you categorize as the culture of each country, you will find many opportunities that can wait for innovation on this level. So, from my point of view, yes, there's many solutions we have to incubate, we have to support, we have to look to in the internal markets and to the exporting of the solutions toward the Levant or toward the international markets. And for this, we just did this joint venture and this strong ecosystem in order to have all the specialists involved in the innovation for the mental health. Basically, all what I need to just here summarize is to focus on the innovation mindset itself. This is also healthy. This is a mental approach in order to get more involved, especially to mix things of solutions and digital transformation with the ethics and responsible when it comes to AI or it comes to any other digital transformation category. Thank you very much.
Thank you, Dr. Rabi. Very impressive. Thank you so much. We are now moving to, let's say, the heart of today's subject. So system integration with Dr. Menatala El-Madani.
Yeah,
Doctor,
hi, good evening.
can
Yes, do you hear me?
yourself, please?
Yes, good evening, everybody. It's a pleasure meeting you all today and being among distinguished guests. And thank you for your invitation, Dr. Alama, and also Dr. Amna for the um, organization for such webinar, which is very important for mental health security and such topic, especially in our current time.
Thank you. Thank you, Doctora. Your first question will be on how can mental health be integrated into border of health systems globally?
Yes, okay. Before start, shall I introduce myself quickly or for the audience?
Yes, you can introduce yourself.
Yeah, sure. Okay. So let me introduce myself to the audience and for our distinguished speaker. I'm Dr.
Please.
Minat Al-Madani. Yes, I'm a physician by background. I'm strategic advisor in public health with a special focus on preventive mental health, digital mental care, and women health and well-being. My approach is combining clinical expertise in internal medicine and emergency with public health and system thinking. I'm also a member in Arab Board for Arts and Health. This is a public organization which work in the intersection of arts and medicine that helps to improve quality of life because this is part of the agenda and the top priority strategies in the UAE. And the second organization that I that I recently joined, the Autoimmune Association in the United Arab Emirates. This is the first of its kind, and it's focused about empowering patients with such autoimmune disease. I'm part also of the medical committee there, and part of that is to improve, to focus on mental health of such chronic disease and to raise awareness about such vulnerable and group of people. So I'm very blessed to be among you, and we can start for having the question discussion.
Thank you. Thank you, Dr. Menatala. We are very proud to have you here.
Thank you, dear.
How can mental health be integrated into border of health systems globally?
Okay. This is a very important question, but let's first to understand or explain a little bit about the mental health system. Like, as we know, the mental health system is an isolated care. Like, it's isolated only in the clinical care, which is the psychiatric care, whether there is a health professional, the psychiatrist, or the psychologist. So if you want to talk about how to integrate the mental health into the system, the healthcare system all along the way, we have first to begin to work on integrated not as a social, not as a clinical isolated service, but also integrated across all the levels. As we know, we have levels of care, primary, secondary, and tertiary, and we have the public sector, which is composed of the public community. So we have three strategies. The first strategy would be integration into the primary care. We know the primary care there where we have physicians of GP, internal medicine, family medicine. They are the first contact of the such system. So if we are having like integration of the mental health, like having assessment in the where you can go to your GP, your medical doctor, and you have just like assessment for example, stress and anxiety, you have a normal conversation. And actually this is happening in the UAE, like especially in Abu Dhabi, they start to have like integration and upscaling, and also across all the UAE, like in the Abu Dhabi and Dubai and the Northern Emirate, to integrate all the such services into the mental services into the primary care. The second thing, which is included in the chronic disease management. The recent research shows that a lot of chronic disease that we have, for example, cardiovascular disease, diabetes, hypertension, cancer, autoimmune, all together are rooted into psychological stress, because stress, chronic stress especially, affects all the body and become dysfunctional and can progress into psychosomatic disorders where people can have a lot of symptoms but without any organic cause. And later on, if it's the chronic stress continues, it's proceed into a dysfunction and then a disease or illness. So integrated, this will help a lot of patients because those of patients having a chronic disease, having a poly medicine where they have like problems in the compliance, their mental well-being will be affected. So if we have a comprehensive care programs that integrate mental health into the management of such a chronic disease, this is another way, which is on the secondary and tertiary care. And then we have integration across the public community and the community medicine or the public sector into the schools, for example, integrating the mental well-being in the schools, the workplaces, the community circles. So this is very important to have such integration across all the community and across all the healthcare system, starting from the primary up to secondary and tertiary. So I do believe this, for this question, the future of such model of the integration will be to have a connected care, that you don't need to go to only psychiatry or a psychologist, but you can access the mental health services across all the stages. Whether you are in the community, you can still access. Whether you are going to your primary care doctor, you still have access. Whether you are a patient with a chronic disease, you still have access. Whether you are finally advanced stage clinical case, then you have the advanced doctors, the psychiatrists and psychologists immediately.
Thank you. Thank you, Dr. Menatala. The next question will be very, let's say, we know in our most of our communities, especially from the Middle East, when patients arrive at hospital, most of time it's at the late stage. Let's talk about the early detection in the workplace.
Yes.
Yes, workplace, especially we know that people are not manifesting their mental health issue in the same way. What, from your perspective, what strategies improve care pathways and early detection in the workplace?
Okay, so you mean in the workplace, specifically in the workplaces?
Even
or in general? Do you want the question?
General.
Okay, in general. Okay. Anyways, if we are talking about the early detection of mental health and mental well-being, this is very important because it's bring the highest return of investment. So if we don't treat, because mental health is similar to the physical health, if you don't treat the symptoms early, it will become severe and more advanced, and you will reach to advanced stage, and maybe it will be complicated. So it will increase the cost of the healthcare cost, and it's especially the mental health. It affects the economic burden. It also affects, if we are talking about the workplaces well-being and mental health well-being and the workplaces, it affects the productivity, it affects the economic growth, absenteeism, like the return of investment. So it's an economic impact. It's not a health issue. And that's why what we are trying to emphasize that, and we are trying to reach to this message to the leaders that mental health is not a health problem. It's a public health and it's a health security. So if you're talking about the intervention, it's very important to talk about how we can improve those strategy and help to identify the cases from the early stages. As we know, we have the prevention where we have the normal well-being. And if we are talking also about the workplaces, before having a mental disorder, we can have signs of stress, at the beginning. Somebody who have a stress response, this is a normal, because a stress response is a normal physiological. After that, if you have a continuous chronic stress, continuous exposure to a stress, this will affect you to start having psychosomatic disorders where you can complain from any symptoms in your body, but you don't have anything organic, or you will start to have like a workplace burnout. Burnout means that a lot of symptoms related to your mental well-being and mental health, that you are not able to work, you are not able to be productive, it will gonna expand to your personal life as well. And if it's become more severe, it can turn to early disease, such as mood, the most prevalent mental health disorders, and anxiety, generalized anxiety disorders, panic attacks, depression, for example. So let's move quickly to the strategies. First of all, to have a routine screening in the public community. So if we can have a routine screening in the workplaces, if we can have a routine screening in the primary care, as we mentioned, integration into the primary care, and across the universities and schools in the academic and academic institutions. This is number one. So routine screening to treat mental health as a normal screening. For example, if we have like diabetes, we go for a public campaigns to have a screening for diabetes, for example. And now we started to see a lot of initiatives actually going to the community, going to the mall, happening in the United Arab Emirates, for having like a very funny interactive, using even digital solutions to have such a screen which is anonymous and private. The second thing, which is related to the digital solution, is to have a digital access channel. For example, if we have a telemedicine, telehealth, chatbots, AI application that can be triage the patient, can have like assessment for if you have some, it can screen you, it can bring a questionnaire for the people, for example, people who have a lot of stigma, such as busy professionals, people working at workplaces, like young people who are afraid from the stigma, who are afraid to speak up or to seek intervention. So those tools, digital tools, whether they are application or platforms, they provide such like assessment, which can later on give you a score, and after that it can refer you, for example, or suggest you, okay, it's better to go and visit like a mental health professional. So this is number two. This is number two strategy, to use digital access channels. Number three, which is very important, and this is what I care also about, is to have a clear pathway. Like if we have, and this is what happened also during like the geopolitical tension that we have faced a lot, is to have like a resilient mental health system that can respond to any crisis, can respond to any economical pressure, climate change, and so on. So how to refer the patient, how to respond to acute cases. If we have, and we see this across the UAE, to have a hotline support across the UAE and 24-hour by a lot of healthcare organization, having already access mental health services, upscaling the digital mental health and the telehealth, because people, they cannot go outside and seek their mental health support. So now the telehealth have found its space. So I do believe it's a combination of multiple strategies to make the early detection very easy, accessible, stigma-free for everyone.
Thank you. Thank you, Doctor.
Yeah.
Very interesting. The next one.
Thank you.
We know that human capital is very important for national and the global economy. I think it's our obligation to take care of human capital health, physical one and the mental one. What priorities ensure resilient and equitable systems? I will not talk about equality, but we are asking about equitable systems.
Okay, equitable and resilient system. Okay, so first of all, let's focus about the definition of what we mean by a resilient and equitable mental health system. If we are talking about resilient mental health system that's able to respond to any crisis and provide the people with the right resources and support during such crisis, as we have mentioned before, different types of crises that we may face. This is number one. And also the resilient system, in my view, it's not a resilient also healthcare, but a resilient communities. Resilient communities that after the crisis. So we are not focusing about during the crisis, but also after the crisis. We want the community to be resilient. Number two, if we are talking about equitable systems, we mean to have like equitable system that have access to everybody, regardless your age, regardless your race, regardless your nationalities, regardless whether you have insurance or not. So this is a very important aspect to have such resilient and equitable. From our discussion, I will share some related and some new points. I have 4 points to discuss. The first one, which is the workforce capacity. If we are talking about the workforce capacity, we have a limited workforce capacity in terms of psychiatrists and psychologists. And our model that we are proposing now is a multidisciplinary care team. What we mean, expanding the care beyond the psychiatrists and the psychologists, because mental health is not related to only taking a medication from your psychiatrist and only psychotherapy from psychologists. You have sometimes psychosocial stress. You have a lot of health determinants. If you
Very interesting. Thank you, Dr. Menaba. You mentioned return on investment, affordability, accountability. We had the chance to explore sustainability and climate with mental health issue with Dr. Najwa. We explore digital transformation with Dr. Rabih, and we explore innovation with Dr. Radwan. As we know, even we used to say that health has no price, there is a cost. Now let's move on mental health economic with Dr. Samuel. Dr. Samuel.
Hi, hello, Dr. Alama. I
Yes.
was just smiling over through because I believe your speakers have done justice to the topic, and it's like they did my work for me.
Whatever we can say, wherever we want to go, how can we do without health economists, without investors, and without a health financer? We cannot do anything without you. Then floor
Right.
is yours. Before to start, can you introduce yourself, please?
Yeah, sure. So my name is Samuel Ampao. I'm with Northwestern University. So good morning from Chicago. Um, I work on designing, implementing, and evaluating mental health interventions. Okay, so I believe as I keep talking, some things will be clear, and then so that's me in brief. You find me. I'm a health economist and a global mental health researcher, focusing on designing, implementing, and then rigorously evaluating interventions to help improve the mental health of people. Okay, so that's me.
Thank you. Most welcome. We are
Mhm.
proud to have you here.
Right,
Dr. Samuel, tell us, how
right.
can mental health investment demonstrate economic value?
Good. I have a slide to show here because this is a bit. My task here is to show the link from mental health to. Can you see my slide? Can you see?
Yes.
It's small. Is it better now?
Yeah, now it's much better.
Right. So my goal here is to show the transition from mental health to human capital and then economic outcomes. So protecting and strengthening mental health globally, especially in low and middle income countries, um, and in contexts where mental health is stigmatized, is essential to human capital building and advancing sustainable development. Oftentimes, when we talk about increasing economic output, we focus on capital flows, institutions, infrastructure, and human capital. But the aspect of human capital we focus on usually is education, skills, and physical health, neglecting mental health. Meanwhile, mental health affects how people learn, how people work, and how people contribute to the economy. I will use a life course mechanism to make this connection clearer. So the first 1,000 days of life, that is from conception to age 2, is known to be the foundation of human capital. Why is that so? Because during pregnancy, maternal mental health, specifically anxiety and depression, affects fetal brain development. And I like that some earlier speakers who were talking about AI alluded that you need brain power to even develop these tools. So if we are saying maternal mental health does affect fetal brain development, we cannot underemphasize mental health. And right after birth, we also see that maternal mental health affects the quality of caregiving, early stimulation, which includes play, and then emotional bonding, all of which affects cognitive development. Okay, so this is the mechanism. Now to the economic value. Early life poor mental health affects educational attainment. It limits skill acquisition and leads to weaker labor market participation in later life. And so at skill, we find that these human capital and labor market effects lead to lower productivity, reduced economic output, and weaker economic resilience. So this is how we see mental health move from affecting human capital and then to economic resilience. It has a longer term impact. And so this is where the economic value of mental health becomes very apparent. Investing in mental health leads to higher productivity, lower healthcare costs. My earlier colleagues mentioned that early intervention, early diagnosis, leads to we being able to treat these conditions early on and not waiting till they get worse, in which case they become more expensive. One other benefit is intergenerational returns. If we focus on maternal mental health, we find in the earlier discussion that it leads to improving fetal brain development. Okay, and so which means that it goes ahead to help with child development and goes on to help future human capital as well. So it's not just a one-off thing. If we target maternal mental health, and we help improve maternal mental health, the consequences become very long term. It moves away from the mother to the child, and this child becomes an adult later and ends up in the labor force, is now able to help develop better digital tools to help address mental health. So we see the rippling consequences of investing in maternal mental health, you know. Okay, so I will move forward now. I don't know, this is it for the first question. I don't know if you want me to continue with the second bit.
Yes, the second, thank you. Thank you, Dr. Samuel.
Mm-hmm.
Very important to link these two aspects. I think all healthcare workers should know about, and
Mm-hmm.
people as well.
Right.
What innovative financing models are most promising? We know that in health, not
Mm-hmm.
only mental health, but
Mm-hmm.
in health, resources remain the same, but we have growing needs around the world regarding health. From
Mm-hmm.
your perspective, what can be the innovative financing models that can be the most promising to
Right.
secure mental health in the
Right.
future?
Thank you. Thank you very much. So from my perspective, promising financing models are those that scale mental health services cost effectively and sustainably. And a key method is to make mental health part of publicly financed health systems, be it insurance-based or tax funded. This cannot be a standalone approach. It will be most effective if complemented by delivery strategies that also support scale and then scaling as cost effectively and sustainably. And these three I listed have been very much emphasized by earlier speakers. So one delivery strategy to consider is integrating into existing systems, primary care, and Dr. Mentala did show how we can also integrate into secondary and then tertiary care, which is very excellent. We can also think of integrating into maternal and child health programs and social protection programs. The other is digital delivery. Earlier speakers also did emphasize the fact that sending these interventions digitally will help expand reach. It also will improve privacy. And one other thing is it helps reduce stigma-related barriers to care. People don't need to go to the hospital. They don't need to be seen accessing mental health, but they can sit in their homes, access their phones, these technology-based tools, and then do have mental health counseling or advice or whatever they are looking for. So it does help reduce stigma-related barriers to mental health care. And the other, which was also emphasized, is task sharing. We need to train non-specialists, which include community health workers, teachers, and peers. If we do this, we expand reach and we don't just leave it to the psychiatrists, but if we think of integrating these into curriculum, teacher training, you know, I believe that it will help promote this financing system. So that's it for the promising financing model. It has to be one that is able to scale mental health services cost effectively and sustainably, and it has to be complemented with delivery strategies that support scale. All right, thanks.
Thank you, Dr. Samuel. You see how important mental health economists are for us. I'm I'm very active and I'm working in healthcare investment and leadership. We are trying to diversify source of investment for healthcare to attract investors to have interest to healthcare system as well as the mental health system, and we are also advocating policies maker to take it like priorities. From your perspective, what metric can we use to convince investors and policymakers to make mental health security as a priority for national economic, and to make it as a priorities for investors? How can we convince them that their money and their investment are not going to be waste in mental health security?
Right, thank you. And this is where my work is focused, because I focus on making available evidence to support policy decisions. So, from my perspective, what convinces investors, policymakers is what? Credible, measurable, and scalable evidence. And three important metrics I identify here are economic metrics, which we mentioned, my other colleagues did mention return on investment. You show them what their returns are going to be. You show them the cost effectiveness of the intervention you are proposing. You show them the productivity it leads to. Okay. And so I did pick a few evidence from the literature. The WHO does show that depression and anxiety alone lead to 12 billion working days lost. And this translates into $1 trillion productivity loss. And this is globally. And another, yes, a publication in Lancet Psychiatry also shows that every $1 invested in anxiety and depression yields $2 to $3 return. So if you are going to investors, if you're going to policymakers and you show them these credible evidence, I believe that we can convince them to want to invest in our proposals. The other is implementation metrics. How do we show them that the solution we are coming are likely to work in real life? So what is the uptick? What evidence are we showing? What does the literature say? We talk about adherence. How are people using the apps? How are people, are they? So for one of my researchers, for instance, it's a chatbot delivered mental health. And so for such, I need to show policymakers that, hey, this proportion did take up, this proportion did stay in the intervention. They kept using the intervention. So it shouldn't just be a non-workable solution. We should show evidence that, oh, this was piloted, we tried this, and people took it up, people used it, and this was a reach coverage. So these implementation metrics are also likely to convince them, so they know that whatever they're going to put their money in are things that are workable. So the third is you show them the outcome and the impact metrics. Is your intervention, is your solution reducing anxiety? What is the evidence? Is it leading to child development gains? What is the evidence? So if we are able to show them these three, the economic metric, the implementation metric, and then the outcome and impact metrics, which altogether show the economic value, implementation feasibility, and real-world impacts of the solution we propose, in my opinion, I believe policymakers will be more inclined towards listening to us and putting monies in these solutions we are proposing. All right, thank you.
Thank you. Thank you, Dr. Samuel. We will take notes. It's very important. Right, Dr. Menatala, that will help us a lot. Thank you. Now we are going to open two collective discussion with first question. I will invite each speaker to respond very briefly, like 1 minute for each one. Is for you mental health should be considered like primary health care? What is the single most critical lever to position mental health as a strategic priority in security, investment, and resilience? Let's start by Dr. Najwa.
Yes, thank you. This is a very important question. And the most critical for me, the most critical lever is institutional normalization through policy. Because as long as mental health support depends only on individual awareness or voluntary goodwill, it will remain uneven and fragile. So we need to move from optional sensitivity to structured responsibility.
Thank you, Dr. Najwa. Dr. Adwan, floor is yours.
It was a great opportunity with esteemed guests and speakers in this session. So if I have some suggestions for as an worker or expert in innovation and in innovators in the region, I think the main issue is or the main the problem here is we don't have a unified ethics or governance for mental health issues in the region. And it is this the solution of this issue is not easy. So we have to work together, all of us, to ensure this governance through innovation and through science matching in the region. We are ready in the AFIA Middle East office for any cooperation with the Institute of Innovation and all of you to work together to realize this this governance to have better societies and mental health security in our communities. Thank you.
Thank you, Dr. Adwan. Let's move to Dr. Rabih.
Rabia. Okay. From my point of view, basically, we have to cutting edge with the elements of fourth industrial revolution, especially investing in AI. Today, we have AI assistant. A good input of AI assistant will be very helpful and very affordable for mental health. Second, the shadow agent of AI, which is supposed to be very well designed based on culture, based on ethics, responsible AI. And of course, when we talk responsible, that means legal. And when we talk ethics, it means cultural. The third point is the agentic AI itself, because otherwise, if we don't invest in AI as an agentic AI, there's someone who will invest and take us toward his culture and toward his mindset. And this is very, very critical. The last point I have to mention is basically about the digital twinning solutions. One, we can merge different elements of fourth industrial revolution, like merging virtual reality, extended reality with AI and good data that is very well designed and structural one. So you can use also extended reality to help in mental health in different aspects. So especially when it comes to the things that doesn't need that much deep seek in the physical layers, and it needs something related to the development of the mental health itself. So, and I know many of the professors in the LP in different issues that they are working to empower the mindset development. They use now AI, and they use AI agentic shadow and AI assistant to help in development mental health. Maybe in this case, I just suggested the good points to start with.
Thank you. Thank you, Dr. Rabi. Dr. Minatala.
Yes. Okay, I do believe that the most important point of my view in the critical lever to position mental health as a strategic point is the leadership. And this is very important because if we are talking about mental health reform, we have to talk from the upper level, from the upper pyramid, which is the leadership. And this is what we have seen actually a positive reform in the MENA region, and especially the GCC, now the reform in the governance, the infrastructure that we have, the new regulation that imposed every period, the new policies that have been changing to support the mental health reform and the mental health system. But now we have like a missed leadership when it comes to the other system, because we are not talking about healthcare only when we are talking about mental health, as I previously mentioned, but we are talking about the other system, the workplaces, the academic, the schools, the community itself. So the leaders of such, for example, if we are talking about mental health well-being in the workplaces, and this is something that really shocked us during the geopolitical tension that we have, that a lot of people, the leaders and the policymakers in the organizations and company, they started to cut the cost for the mental health support during the crisis, although this was affecting the employee. The employee now shifted to online, so this is very important to cater or focus about the leadership. And this is part of the advocacy that the ongoing discussion that I'm having also the last 4 years with the policymakers, with the leaders, about that this is not a single system problem. This is like a whole system problem. So it's like a shared responsibility. So in terms of mandatory frameworks or mandatory solution, it's about mandatory strategies, mandatory tools, policies, and then I want to end by that it's a shared responsibility, that everybody is responsible about that. Yes, I emphasize about the leadership because it's very important, because health and mental health reform without policy and without government, we will not have anything. And of course, on the layer with the economics. But on to lever that and to implement that, we have to integrate all the healthcare system and all the non-healthcare system stakeholders, the families, the community, the workplaces. So at the end, I want to just end by saying that it's a shared responsibility.
Thank you, Dr. Minatala. Very good points. I like it.
Thank you.
Dr. Samuel?
Yeah, so tying together all that has been said and leveraging Dr. Mentala's point, yes, the critical level for me is to reframe mental health not just as a health issue, but as a human capital and economic issue. If we do this, we bring all on board easily. It elevates the relevance across finance, education, labor, and the private sector. Everyone would feel like they own this. But if we leave it just to the health, I mean, the finance folks will be like, well, it's for the health folks. But then if we do redefine, reframe mental health to naturally bring together all these people, I believe there will be buy-in, and then that is for me what a critical lever is.
Thank you, Dr. Samuel. before to go ahead with the next and last common question, I will self-invite myself to give my point of view on that question. For me, priority should be two things. That's my experiences in medical field, the pharma field, the global health, health economic, and leadership and investment. For me, there is two most important pillars: the good leadership, enough money. No more. If you have the good leadership without enough money, without the right tools, we will kill ourselves. If we have enough money, we have the right tools, we have not the right and the good leadership, we will waste money and we will not be efficiency. Then Dr. Amna, floor is yours.
Thank you, Dr. Allama. So we now move to our final forward-looking and action-oriented common question, and we would appreciate brief and concise responses. Let's begin with Dr. Najwa Zahar. In your view, what is the single most important priority action that should be implemented within the next 12 months, and which key partners are essential to making it happen?
Well, how about to launch a regional cross-sector task force on mental health resilience in the Middle East? That could be a great opportunity, a great initiative with a practical mandate to identify priority policy gaps, define minimum governance standards, and propose, why not, pilot initiatives linking mental health with climate resilience, education, workplaces, and sustainability. The right partners for this initiative could include ministries of health, education, labor, environment, regional and international organizations, universities and research centers, private sector, especially the ones committed to ESG and workforce well-being, digital health innovators, and civil society organization with commonly reach. So the strength of this initiative would come precisely from this multi-stakeholder design, which is also fully aligned with the webinar's intended outcomes of collaboration, strategic insight, and future regional initiatives. Thank you.
Thank you, Dr. Najwa, very meaningful. Dr. Radwan?
Yes.
Your response, please.
For my point of view, the priority is for governance through the region for the technology use and the mental health security, which cannot be realized without cooperation and cross-border and regional working on this issue. So the governance, I think, is a priority through innovation, and I think innovators can do a lot. We have in the region in Lebanon and in the region, we have a great pool of innovators with infinity capabilities. So let's work together. We can do a lot with this.
Thank you so much. Dr. Rabia Balbaki?
Actually, Dr. Amna, I found probably the most complementary for what Dr. Najwa and Mr. Radwan just mentioned is to work in the human development, provide them with good tools, not any tools. It's supposed to be very well designed based on expertise, based on multi-stakeholders, and based on AI, of course, because in this case, we can work in a plan for a short term and midterm, maybe later on for a long term, but to test it and develop it in the right way. So in this case, we can create a platform, and this platform, of course, consists of a lot of things regarding the development of the human resources, from the algorithm, from using of tools, from the expertise themselves, then join it all together in a one platform in order to have a reference resources that can help to not only have the solution, but to have the digital equity on the table.
Thank you so much. Dr. Minatullah?
Yeah. Okay, for me, in my point of view, for the priority action for the next month that I'm proposing in such a webinar is to launch like a national or regional mental health integration pilot across like multiple sectors. And because what we have seen, which is a positive actually steps that we have like some programs, some pilots in workplaces, but in schools environment, across the community, but they are become isolated either or not implemented completely. So those are the two gaps. So what I'm proposing, the pilot to have integrated comprehensive care, and this is one of the models that I proposed, and I won like international prize, the Titan Healthcare Award, for designing such a solution which combined the public health, the community intervention at the first, then access to the healthcare system, and then outreach to the community back to connect with the workplaces, schools, academic, and so on. So it's a start with the community and it ends with the community. For the pilot, it will focus on four things that I have mentioned before: early access and screening, fast referral pathway, this is very important, digital support and digital use of the digital solution, and data measurement and outcome, because this is very important, as someone said, because we need the economics. We need to convince the investor and the policymakers about that such pilots and such redesign of the model having a real impact. And for the stakeholders, it will be like everybody. We need to engage the healthcare system. We need to engage the non-healthcare system, education, employers, the technology partner, the insurance as well, and the community organization. So I will end that the 12 months should be, the pilot should be like, and this is one of the proposals that I'm, one of the models that I'm working on and proposing that, which is a comprehensive model, integrated care, culturally aware, especially in the MENA region, because we are talking about the MENA region, and fast and endly, finally, which is trauma-informed care, because we don't need the people to be re-traumatized from the care that we are delivering. We need the people to trust such solutions. So these are my final proposal for today.
Thank you, Dr. Al-Madani. Dr. Samuel, please.
Yeah, all the proposals seem to converge, and I am not diverting from it either. So I would say that my proposed priority action for the next 12 months is to scale mental health through existing public health financing and delivery strategies or systems, sorry. And key partners will be governments, health systems, payers, that's public insurance schemes, education and workplaces. So it's more like, let's work towards bringing everyone on board. A multi-sectoral approach is what I will propose.
Thank you so much. Dr. Allama? You're muted. Your mic, please. Dr. Allama, can't hear you.
Sorry.
Don't worry.
Well, can you hear me? Okay, thank you, Dr.
Yes,
Asma.
no.
Thanks to all of you. Discussion was very interesting, very productive, very dynamic. MashaAllah alaikum, all of you. We highlight the need to align governance, investment, innovation, and system integration to reposition mental health strategically. What I keep some things that I'm always advocating is a multi-sectorial approach. That's the mindset and let's say the driver of Global Innovation Institute. That's why all our webinar, we are giving seats to everyone from different sector and different countries. Why? Because health, climate, economic, finance, mental health is a common good. All of us are stakeholders, and we cannot innovate without collaboration. If we want to innovate health system, mental health system, any kind of innovation we want to promote and to implement, we cannot do it without collaboration between all sector, between all generation, between all gender, and between all countries. Then thanks to all of you for being here. I think we have 4 questions. If you don't mind, maybe we can reply if we still have time. We have 4 questions before to conclude the webinar. 4 questions from the same participant, Mr. Mustafa Sheikh. Mr. Mustafa Sheikh is asking, how is mental health correlate with AI and latest technology? Who want to reply?
If you like, I can reply to him.
Yes, most welcome.
Okay, as just I mentioned in the questions after the session, that you need to feed and to seed AI assistant and AI shadow and agentic AI. We have to work in developing AI agents specialized for the region and specialized for certain countries and certain specialties, because each one have to be fed in the things that needed based on the achievements or based on the goals you want to achieve. So I believe the best way is to work in developing agentic AI for mental health.
Thank you. Thank you, Dr. Rabieh. The next question from the same participant is how to keep a balance in mental health and work pressure, keeping project deadline and family life.
I can answer.
Yes.
Yes, okay. Thank you, Mustafa, for your question. Your question is about how to balance mental health with work pressure. As I have mentioned, like mental health in the workplaces is very important because it can extend to burnout if not managed well, and it can advance to mental illness in the initial stage and can extend to the life. So one of the strategies I will propose for you, Laz, is to have a boundaries between your personal life and your professional life. This is very important to maintain your mental well-being. The second thing is to develop your resilience. To develop your resilience is to develop like coping strategies and stress management for what you have. For example, if you have like a pressure from keeping projects deadline, so it's about like having self-time management, self-management as well, like managing your emotions, like being able to divide your tasks. So it's a combined of psychological skills and personal skills. So it's very important to work with someone who can help with you, whether they are mental health professional, whether they are coach, to provide such thing. And also if you have any psychosocial stress in the family circles is very important, or if they are supportive, they can support you in the meanwhile. So it's about strategies, tools, and skills that you have to equip yourselves, and also it will start with the awareness in the beginning. So I hope I answered your question.
Thank you, Dr. Minatala. The next question, specific. Is there any benchmark to measure stress? I think that's Dr. Samuel.
Yeah, can you hear me?
Yes.
Yes, I have worked mostly with depression, and I do know there are a few benchmarks to do measure depression, but not stress. I don't know if the psychiatrist here can help us. Yeah.
It's a very specific question, special one. Maybe Mustafa Sheikh, maybe we can reply to
Mhm.
you when we will have a when we will have a response for your question
Yeah.
next following days, inshallah. The next one is stress correlated to vitamin and its deficiency? If anyone can reply?
Yeah, I can reply to that. Okay, since I'm a physician, stress related to vitamins and its deficiency. It's not about stress correlating to that. It's about mood. If we have like stress in our life, we have to identify what are the cause of the stress. Usually, if we have like swinging moods and so on, maybe we can relate it to vitamins or to lifestyle modification. Because stress or mental well-being is related to a triangle that I called it like the mental well-being triangle. That it's started with the proper sleep, with a proper nutrition, with a proper also movement. So it's about first to have the lifestyle fixed, the non-negotiable. This is first. Number two, if you still like have something affecting your body, maybe you have to go for like having, if you have a low mood, not stress, but stress, this is a normal response. Like to have a stress in our life, this is a normal response if it's short and manageable. But if it's a chronic stress, it will not related to vitamin deficiency. Maybe the depression or the low mood, continuously low mood, it will be related to vitamin and iron deficiency or vitamin D deficiency. But stress, it's really related to something happening in your life that you are not able to manage. So like there are overlapping aspects between stress and between like your mood. So it depends. You have a stress or you have a mood issues. I hope you answer. I hope I answered your question as well.
Thank you, Dr. Al-Madani. We are very proud to have you all. And let me say that mental health must be addressed as a systemic driver of resilience and sustainable transformation.
Thanks.
That's it.
Thanks to all of you, all speakers, for your valuable contributions, and thanks to all our audience for making time to be with us here.
So we look forward to continued collaboration. This session is now concluded.
Thank you.
Thank you so much.
Thank you, everybody.
Thank you.
It's a pleasure being with you.
Thank you,
Good
Dr. Anita. Thank you all. Bye-bye.
Bye.
Bye, everybody.